Hello, everyone. My name is Kylie Flores. I'm currently a student at the University of Tennessee at Chattanooga, and I'm also a student health ambassador for the Meharry HBCU Wellness Project. And today I will be talking about my research project titled The Effects of Mental Health Stigma on Therapy Access and Consumption in Chattanooga's Black and Latino Communities. So, first of all, I wanted to give a bit of a background. One of the main motivations for me conducting this study is because access to and usage of therapy um, definitely depends a lot on one's ethnicity, among other factors like socioeconomic status, religion, other factors like that. According to a 2012 study, African Americans are less than half as likely to use mental health resources as white Americans. And furthermore, in 2023, um, uh, one of the leading causes of death of young people, specifically in Latino and Black communities, was suicide. So there is a large need and demand to understand why certain communities, specifically Black Americans and Latinos, are not utilizing such an important resource. There could be a lot of reasons for this, socioeconomic barriers, income, education, shelter, but this study specifically focuses on exploring different reasons why. So, continuing on that, so my research question was, how do specific cultural, religious, and other social elements discourage African Americans and Latinos from going to therapy? So, data gathered from the research may clarify how proper education about therapy can, you know, illustrate why some people are not using therapy resources and why it's also a beneficial resource for a lot of people. So specifically, my methods were mostly through surveys. I have a picture of my flyer that I used to spread my survey there. Um, People could just scan the barcode on there and it would take you to my mental health survey. So I collected data from students across various backgrounds, specifically Black, Latino, and white young adults who answered my survey, about ages 18 to 25 years old, to answer the survey, which was about therapy access and consumption within their families. I used flyers, emails, and connections through word of mouth. My results. So I on here I have a pie chart showing the proportions of therapy usage and their percent likelihoods. So, for example, 2/7 of my respondents answered that they were about 40% likely to use therapy resources. Um, so, about 43% of participants overall said therapy wasn't available to them. Half of the Hispanic women and half of the Black women said therapy was available to them. 43% of participants, all Hispanic or Afro-Latina, said that the feelings of vulnerability and feeling exposed associated with going to therapy were really notable aspects of um, not using therapy, things that held them back from using therapy. Another really interesting piece of data I found was a large percentage of respondents mentioned that their religion, every single respondent actually mentioned that their religion, um, not their religion, but religion can be a factor that keeps people from using therapy resources. And about 40% of respondents mentioned that um, like societal ideals of masculinity also can prevent people from using therapy resources. And a large proportion of them were Hispanic. So further research could clarify the intersection of race, ethnicity, socioeconomic status, religion, and therapy usage that I established in this research project. My main limitation was the limited number of responses that I received. So in future, I would like to receive more therapy responses to my survey, and I want to distribute more informative resources to the Chattanooga community to spread proper education about therapy. Thank you to the University of Tennessee at Chattanooga and the Tennessee Meharry HBCU Wellness Project for everything for all the help surrounding this research project. And thank you.